You doing?
There you go. I'm doing great. How are you?
Doing great.
Looks like you're just getting done with work, maybe.
Yeah, so I'm a mobile urgent care, so I'm always on the road.
How about that? Great. Yeah, I read a little bit about that, and that was one of the things I was going to ask about. So, anyway, I'm Luana. I'm one of the nurse practitioner faculty here at Regis College, and we're glad to get a chance to talk with you for a minute. If you could just maybe give an introduction so everybody will know who you are, and then we'll kind of jump into just finding out a little bit more about what's going on with your practice there.
Great. Yeah, so my name is Brad Bigford. I'm a family nurse practitioner. I graduated from Gonzaga University in Spokane, Washington, with my master's, and then I graduated with my bachelor's degree from Boise State University. I've been practicing for about 8 years now, and I own my own practice. It's called Table Rock Mobile Medicine, and I service Boise, which is the capital of Idaho, and the surrounding cities. And we do what I call minor urgent care. So I see a lot of things like COVID, dehydration, migraines, lacerations, anything you go into a walk-in clinic for.
Okay, great. So tell me where the idea of, that mobile feature came about from, and did it have anything to do with access to care? Because it's really unique.
Yeah, so I grew up in a really small town. My graduating class was 28 people. I think
Okay.
our town population was a little under 1,000. And so I realized the lack of access to healthcare in rural areas, as well as when I first started it, it was based on an idea because a lot of my friends and family would ask me, hey, could you come over and look at my kid's rash? Or could you see
Mhm.
if my kid has an ear infection? Kind of simple things that, don't require a lot of resources for. And I wanted to own my own business, but I didn't have the startup capital to kind of get that going. And my wife and I figured we could start up a mobile house call practice, accept insurance like Medicaid, Medicare, Blue Cross, and a bunch of the other ones at a relatively inexpensive rate because we don't have the huge overhead of like a practice of like a brick and mortar building. And so we decided to go for it. And I think our startup cost was a little bit more than 4,000, which included things like malpractice insurance. And I have a friend of mine that does medical billing and credentialing. And so he got me, fully credentialed with a bunch of the payers. And within a few months, we were up and running and seeing patients.
Wow, that is just amazing. So, what has the experience been like as far as the community and the support for your business? And tell me a little bit about what that's like and what your day is like, a typical day.
Sure. So the support has been great. So 90% though of our patients are moms with kids in the home. And when I say that, it's like the moms aren't always the patients, but they're the ones calling. So
Mhm.
they call for themselves, their spouses, their parents, and their children. For some reason, a lot of elderly patients think we're a scam, so they
Mhm.
actually don't usually call us. So the majority of our visits are like mom who's like between late 20s to early 50s. We'll see a lot of little kids. We see a lot of teenagers and things. And so the majority of our day is, we see about one patient per hour per nurse practitioner because there's four of us in the practice now. We see about one person per hour, which includes drive time. And then we'll do our own lab. So like the last house I did was someone who's sick. So I did a rapid, COVID test on them, did a PCR because that was negative. I'm taking it to the lab after this phone call. And some houses I do like an IV if they're having a migraine. So the last house was COVID positive, already knowing they were positive and treating their symptoms. So yeah, the vast majority is like a middle income. They could be kind of suburban or even rural. So we go to a few small towns around Boise that are very, very rural. And then we're also, oh,
I'm still here.
oh sorry,
Oh,
my
that's
computer just popped up an error.
oh, that's okay.
And then sometimes we're even like in downtown Boise, kind of in the heart of the city. So we're kind of going all over. We have a really wide service area. And yeah, so it's essentially, kind of just that quick care kind of visit, but we try to increase access to healthcare by a few ways by accepting almost most insurances, including Medicaid and like TRICARE.
Mhm.
And we offer like huge discounts for people who are self-pay. So we give 50% off the total bill for people if
Wow.
they're self-pay. And then, yeah, we'll go to them for any reason. They don't have to be like, it used to be Medicaid and Medicare. you had to be homebound
Mm-hmm.
to get a house call, and that's not the case anymore. CMS
Wow.
changed the regulations that they don't have to be homebound. It's
That's
built,
amazing.
yeah, it's billed just like a regular office visit. So it's a most of our visits are like a 99203 or 213
Mm-hmm.
in
Mm-hmm.
terms of complexity. And then we do some procedures in the home like suturing or ingrown toenail removals or stuff like that.
Okay. Wow, that is amazing. Is this something that's you've seen in other states or other areas as well that's going on?
Yeah, so there's like a really big company that's in a bunch of major markets. They're called Dispatch Health. They're kind of our
Mm-hmm.
competitor in the
Mm-hmm.
local market. But they're, owned by a bunch of venture capitalists. So
Right.
I'm not, I don't have the funds to compete with them. But and then there's a bunch of, mom and pop kind of businesses that are kind of all
Mm-hmm.
over. There's a lot like I've read about, there's a lot in like the Southeast,
Mm-hmm.
but United States, but
Yeah,
I'm the
because
only
I'm in
one.
South Carolina, so I'm wondering if there's any in our state now that I'm talking to you about
Yeah,
it. Just
yeah, Google mobile urgent care, and you might
yeah.
see, one or two. There's a lot of nurse practitioners doing it.
Yeah, I could definitely see where there's a market from it. I'm from a small town too. Now, my graduating class did have 80 people, so we did beat you
Oh,
out,
you're
but
big.
not by a lot. But very small town, and yeah, definitely have a lot of rural areas, a lot of barriers to access to care. So it sounds like you've really done something amazing for the community. Tell me a little bit about what COVID has done to kind of first of all, change the way that you practice and also some challenges that you may have had to meet that are unique to what you're doing.
Yeah, COVID when it first hit in Boise, we were one of the we were one of the kind of the hot spots when it first came up. It was like New York and Chicago, sure, but actually, if you look at the time frame, Boise and the surrounding area, we were one of the highest
Wow.
concentrations of positives. So it hit us really early on, and we were struggling really hard to get even just masks and goggles and gloves. We're a tiny practice, so our purchasing power with a major
Mm,
distributor like McKesson, that's
right.
who we normally use, they were like, sorry, all the health systems, they bought it all up, so
Mhm.
good luck. So I actually put out a Facebook post saying if anyone has any like N95s, like maybe you're a general contractor and you have an N95, if you could spare a couple, if you maybe have some even latex gloves, we would take it. And all
Mhm.
of a sudden, we found that we were this PPE donation site for some.
Wow.
So I had friends that were working in small little rural hospitals, just like 3 or 4 bed, emergency rooms. They were
Mhm.
messaging me like, "Hey Brad, if you have an extra PPE, like a N95, could I have one?
Mhm.
Because I'm sharing one with the night nurse.
Ooh.
They come on shift, I give them my mask, and then when I come back tomorrow, they'll give it back to me."
Mm.
And so I'm like, messaging little family practice clinics too, like, hey, if you guys need a couple of masks, I can drop some off. And that was, April, May, June when we couldn't get anything. So that
Mhm.
hit us pretty quick. And since then, our supply has gotten better. But COVID now, I think we saw our most amount of patients we've ever seen over the last 3 days. I mean,
Mhm.
right now in Boise, they're talking crisis standards of care. It just got initiated in North Idaho, and we're on the brink of our hospital systems, being overrun. So
Mm.
we're trying to keep people out of the hospitals right now by doing testing and treatments. And so that's where like it's just dominating our practice, and we're not
Mm.
even able to see people that we would normally see for non-COVID issues. And I feel horrible about that we're getting
Yeah.
so busy that we can't keep up.
And I think that's something, that we're feeling across the country. Here in South Carolina, we have the most cases per capita of any state. So we get to be number one for something as horrible as that.
Yeah, that's
In
something
the
I don't
past, yeah, in
understand.
the past 4 days, we had 20,000 positive tests. And I'm like, but we had we've had football games, college football games where you have 50, 60,000 people,
Right.
and you're thinking to yourself, what is the outcome of that going to be? So it really is distressing. And like you said, the chronic issues that we're facing, the people that are diabetic or have cardiac issues or things like that are having to sit on those. So it's costing us in more ways than one with all of this that's going on. So that kind of segues us into, of course, the topic of vaccines. Now that we have the Comirnaty vaccine that's been FDA approved, it's become kind of a polarizing topic, a politicized topic, of course. What is the general feeling in the area where you all are as far as vaccination rates? And, how do you think as healthcare providers, we need to speak to that?
So our vaccination rates in Idaho as the state is one of the lowest in the country. In my area, which is, Boise is actually, kind of a Democratic city, but the surrounding areas are very, very conservative, very Republican. And so it's kind of a, two sides of the coin just by driving a couple of miles. And, you can really feel it in terms of who is getting really sick really fast. I'm trying to talk to people, not just in their houses about, vaccinations, but I'm trying to talk to people. Like I do Facebook Lives every week. I'm on Twitter and Facebook. So I'm trying to be where our patients are on social media and talking to them in a larger setting than just this private conversation, like in an exam room or in their house. And those private conversations are really powerful. They carry a lot of weight with people because they get to know you and trust you. And nurse practitioners and nurses in general, we're a very trusted profession based
Exactly.
on the Gallup polls that, have been going on for years, but we're not able to reach the masses. And so that's why I'm trying to be out there on as many platforms as I can, because that's where our patients are. If we're not out there, the only people that are the anti-vaxxers that are spreading misinformation.
Yeah.
So I think
Yeah.
more people that are knowledgeable in healthcare and science, if you're not talking to the general public, well, the opposite side will be. And I think
Yeah.
the message needs to be, about acknowledging people's fears. Because if you don't acknowledge the fears and you're just talking through them and about stats and things, you'll never reach them. So you need to address their concerns and acknowledge them and, validate their concerns. It might be something completely off the wall, but if you don't even acknowledge it, then you're never going to gain their trust.
Yeah, that's true. And that's very important. And I'm glad to see, social media is definitely something that has changed the way we communicate. And there is quite a bit of misinformation that's there that's being posted. And so being able to talk about it, in a positive manner and say, yes, there are things that you may be scared about. I mean, even as healthcare providers, initially when all of this started, I was following a Dr. Schwelt that's done a lot of videos, probably about 150 now on COVID, because he's working with COVID patients out there. And one of the things he said in the initial video was that there was going to be hesitancy about the vaccine because a lot of people would think that it came about really fast. And that was the same even with healthcare workers. So my job was to educate myself, but it's a lot easier for us to educate ourselves sometimes than to bridge that gap with patients. So with social media, it definitely is something that, can play to our favor if we're able to get out there and talk about it. Do you feel that you're going to be able to make a turn? I mean, I know here in South Carolina, we're probably around 40% vaccinated. And I remember when I first went to get mine, the lines were out the door. And now I passed by, like today, I went by a testing site and it was full, but only because probably we had a big college game this weekend, but because it was empty last week when I passed by. But the site that does the vaccinations, nobody over there,
Yeah.
so do you think there's something else that we need to be doing from this side? And I even know a few healthcare workers, unfortunately, or nurses that have made that choice, and I respect everybody's right to choose, but I just, it really makes us wonder, what else we can do to try to allay any of those fears.
Yeah, I don't have any more ideas other than, we all need to be, kind of in this together as healthcare workers and putting
Mhm.
ourselves out there, because a lot of people like, oh, I don't want to choose sides, or I don't want to make my patients mad, or I don't want to get caught up in the middle, or I don't want my employer to find out and get negative
Mhm.
reviews against me, or whatever that may be. Right now, Boise and Idaho, we are seeing like a mass trauma happening in front of us. And if we aren't doing everything that we possibly can as healthcare workers, not just to help those that are suffering and sick, but to prevent those from being sick and suffering, an ounce of prevention is a pound of cure kind of deal. So if we're not doing everything that we possibly can right now, then we're going to see loss and trauma like we've never seen since the 1918 pandemic.
Yeah, you're exactly right. And we're not a resource that can be stretched, but so far, we have nurses that are leaving the profession and going home, because they are afraid, of what's going. And then we can only think about the mental health repercussions that's going to happen on the other side of this from those nurses that have been on the front lines, people like you that are having to sacrifice the patients that maybe you'd like to see for the patients that you have to see. That always plays an emotional toll for us as well. So it's just something that you definitely right. We're going to have to work together for the first time. And I think about this because with Regis, the sisters that founded the college founded it on the principles of caring for the dear neighbor. And so at no other time that I can remember in my lifetime have we really been our neighbor's keeper. So
Right.
this is where we find out, really how humane we are,
And that's the thing too about with the COVID vaccine. It's people are like, oh, it's like wearing your seatbelt. It's not like wearing your seatbelt, because wearing the seatbelt doesn't protect the other drivers. It's like not driving drunk,
Yeah.
because it's when you get vaccinated, you're protecting your neighbors, you're protecting those vulnerable people, and you're stopping the spread. And when I see so many people in my neighborhood and community against the vaccine, they are not being good neighbors, and it just breaks my heart.
Yeah, it is heartbreaking. And then even here with the mask, because, I've told people, if you're not going to get vaccinated, they don't want to vaccinate or mask. I'm like, can we do something? What are we doing to help in some way? Because we know that the vaccine is a big piece, but there's also the social distancing and the mask that will help as well. But I'm like, you gotta do something. We have to be contributing in some way to a solution,
Right,
and
yeah.
that's really important. Yeah,
They don't
really
want to get
important.
vaccinated, they don't want to wear masks, and they want to go to
Yeah.
football games. It's like, what is
Yeah.
your plan? What's your plan
Mm.
to get out of this? If you don't want to do anything and you want to go to all these parties, what's
Yeah,
your
it's hard. Yeah. And I work for Regis remotely, but I also work on a college campus that has quite a big presence. So that's been the thing with students. We've been encouraging them, listen, you need to get vaccinated. If you decide for some reason you're not, you need to have a mask on 100%. You don't need to be congregating, because that really is going to make for a really bad time for all of us. It really is. So I want to close out by switching gears completely
okay?
to the fact that you are the first male that I have talked to with all the nurses that I've been interviewing. So, I know that male nurses are still pretty much a rarity. We see a lot more than we used to, probably about, I guess, somewhere between 12 to 13% of the nurses in the nation. So, anything that you can say that's been unique to your nursing experiences as a male, even to the point of maybe some biases that you've had
Yeah.
to overcome, that I would be interested in as well. Tell me a little bit about that.
Yeah, that's a great question. So when I was going to nursing school, which was about 2002 to 2007, some of the nursing instructors actually did not feel, they were like the certificate nurses from like the
Mhm.
60s and 70s. They
Right.
did not feel like men should be in the profession. And they were like harsh on the three guys that were in my nursing class.
Wow.
They did not like us. And so that was where I first kind of felt it. And then, and please don't let me feel like I'm complaining as a
Oh,
male
no, I know that.
country.
No.
Yeah, I am not complaining. So, but the other thing was, I was called Greg Fokker a lot in nursing school. That's the
Wow.
what's his name from Meet the Parents,
Oh,
Ben
yeah.
Stiller, from the male nurse,
Right.
kind of stereotype. People think I'm either a homosexual. They think I'm either or a physician. They kind of assume that I'm not a nurse.
Mhm.
And so you know I I don't understand where this bias comes from, because some of the first nurses were actually men
Mhm.
in like the army. So yeah, so I don't have never shied away from being proud of being a nurse. Sometimes I get maybe a woman who's very conservative, or maybe of a specific religion, that doesn't want a man
Right.
involved in their care, and I completely understand that and respect it. And I have no problems, if they say, please, could you find a lady?
Certainly.
Absolutely.
Yes.
I have no problems with that whatsoever. So I've kind of experienced a little bit throughout my career, but at the same time, I feel like as the years have gone by, I feel like it's a lot more, you know, normal to have
Right.
have a man involved in their nursing care. And then since I've been a nurse practitioner, I don't even think it's ever been a real issue, other than when I was doing clinicals with the nurse midwife in an OBGYN clinic. I think
Mm-hmm.
half of the women were like, nope, he can't come in.
Yeah.
One person
Right.
said I was going to get turned on doing a pap smear, and I was like, oh,
Right.
you're
Yeah.
a little too, you know,
Yeah, that
center
can
yourself.
present a problem. I used to be an clinical instructor, and I had a nursing group in labor and delivery, which is my background. And I had one male student, and I thought to myself, I wasn't worried about him because he was great, spot on. But I
Yeah,
thought in clinical, I'm like, oh my goodness, are we going to have issues? And surprisingly, the first day of clinical, he actually saw three deliveries, including a C-section. Everybody, so he was just the oddity. I'm like, you're just great, because he was able to do that. But it does present a particular challenge. But what was it that actually made you decide that you wanted to be a nurse? And by the way, we came out of school about the same time because I graduated in 2006 with my nursing degree, and then my NP was 2012. So the timeline is kind of similar.
that's yeah. I got my associates in '06 and then my bachelor's in '07. So Boise State back then had a bridge program,
I did the
and I
same
got
thing.
my master's December of 2012. So that's fun.
I was in July, so I beat you a little bit.
So what was your question though about male nursing again? Sorry.
And I forgot what I asked you to. That's terrible. I got so sidetracked by that. But I know we were talking about the fact that what was it that brought you to
Oh yeah.
nursing? What made you
Yeah.
decide to be a nurse?
So in high school, and my dad was a Seattle firefighter,
Oh
and
wow.
he was retired. So I was like, you know what? I think that's what I want to do. I want to help people. I want to be a firefighter. And I graduated from high school, and Boise State back then was they had an EMT, paramedic, and firefighting program. I was like, I'm gonna go to college, and that's what I'm gonna get. The summer I moved to Boise, they cut the program,
Oh wow.
and I was like, I don't know what I'm gonna do. That was my whole goal. That was my plan. And so I'm taking my, general classes that year, and someone, as we were walking by a nursing building, one of my friends joked and said, hey Brad, why don't you be Greg Fokker and go to nursing school and be a male nurse?
Wow.
And I thought about it. I was like, what are when you kind of dig down to it, what are the goals and the mission of a
Mm-hmm.
firefighter and a nurse? And I felt like they were very similar. I was like, you
Mm-hmm.
know what? Screw you guys. I will become that.
Isn't that something? And in a way, you kind of blended all of that because, paramedic, now you're mobile and so you're out in
Yeah.
the community. So it's
Yeah.
all the same. So that's great. Well, I want to thank you for your time. I know you've had a long day and you still got to get back to the lab. And I appreciate being able to talk with you. The only thing that would have been better is if we could have done a ride along and actually see what the day, plays out like. But hopefully that'll be something maybe for the future. But
Oh yeah.
I do appreciate the work that you're doing. Really hope that the outcomes will be great for you and for your patients and for all of us as we try to work together to pull out of COVID and also to advance the nursing profession. And it was really great to get to meet you and talk to you this afternoon. Oh, we have one other common thing. Your
Okay.
first name is my maiden name. My original name was Lawana Bradley. That's my maiden name. That's my birth name. So there we go.
Nice.
6 degrees of separation, right?
Excellent.
All right. Well, enjoy the rest of your evening and do take care.
Thanks so much. You
Thank you.
too.
Bye-bye.